All right, Demiathia. Welcome to your interview today. And I'm going to go ahead and ask you several questions and then go ahead and answer them as best as you can. And the floor is all yours, okay? So, whenever you're ready, let me know when you're ready to start your interview, okay?
Okay, I'm ready right now.
Okie dokie, give me 1 second, okay? All right, so first question. What are the main expectations of a green scrub while working in the hospital?
To remain in character, to help give out med kits and pills, to make sure you just stay in character.
All right, perfect. And just of course also just learn the hospital rules, get a great knowledge of that, and then make sure you just keep practicing your micros.
Yes, yes.
But good answer. Okay, question number 2. Why is it important for green scrubs to remain supervised?
Because sometimes they may step out of line and talk to the patients who come through here, and they may say like interact with them in a way that they're not supposed to, and sometimes they might break the rules of HP. So sometimes it's best that there's someone above us who will let us know that we're in the wrong. That way we can fix the problem.
Perfect. Great answer. All right. Question number 3. Why would who should you contact if you need help during a hospital scene?
Our supervisor, someone above us.
Great, perfect. So yes, you'll contact a higher rank. So for example, let's say you're green scrub, right? And then only ones that's on the floor right now are white scrubs. You can go ahead and ask them a question that you may not know or what you should do in a certain situation. But any higher rank will be able to assist you. Okay. If let's say either myself or a DCP or let's even say chief is not present, you can always contact uh, from white, like let's say right now you'll do a white scrub, pink scrub, blue scrub, brown scrub, or a white jacket, purple dress, um, yeah, white jacket, white coat, or purple dress, purple pants.
Okay.
But yes, great answer. All right, why number 4? Why is proper micro usage important during medical RP?
So that way the patient knows what is being taken place. So if I was to do CPR, the patient needs to know that I am checking their vitals and getting ready to start CPR. You can come over here, Brett.
Perfect. Yes. So just to make sure we go ahead and keep RP
I am so
structured,
sorry about
professional, and clear during medical scenes. Like you said, when we're doing CPRs, just let us know what the patient knows what we're doing, and
Yeah,
the
that's
people
fine.
around us.
Yes, ma'am.
Okay. Question number 5. Where are green scrubs allowed to sell med kits and pills?
Green scrubs are only allowed to sell med kits inside HP behind the desk.
Perfect. Great answer. Okay. Question number 6. Why is why is learning hospital structure important at this level?
I'm sorry. Can you ask that question one more time? I
Of
didn't
course I
quite hear
can.
you.
Yeah, of course I can. Hold on 1 second. Okay, so why is learning hospital structure important at this level?
At this level, it's important because some people lose courage and they like to maybe think about quitting and going to other jobs. But if you have structure and HP, you will be willing and have the willpower to maintain good, headstrong focus on becoming higher ranks in the hospital.
Yes, to help the staff, understand the hospital structure and who to report to.
Yeah.
All right. What should you do if you see someone breaking hospital rules?
Immediately contact your supervisor and let your supervisor know that they are breaking the rules of HP.
Awesome answer. Yes, you just let leadership know or someone of higher rank know, and try do not handle it yourself because of course you don't want to get yourself in trouble. Let someone of higher rank do so, so that way we can go ahead and de-escalate the situation, and it also protects yourself.
Should I also turn on my body cam?
Yes, that would actually be perfect because body cam footage will help show evidence of the situation, and then it can get taken care of.
Okay.
All right, question number 8. What skills have you learned that prepare you for white scrubs?
I have learned the new CPR macro. I didn't know how to do it before, and I now know how to do it because I had a perfect training class to teach me how to do it.
Awesome. And then also just, keep understanding the rules, learning the rules and the hospital procedures.
I'm still working on those,
Of
but yes,
course.
I'm getting those down as well.
Oh yeah, you learn as you go. Trust me, you learn as you go. Okay, question number 9. When must your body cam be turned on?
You should turn your body cam on when you feel like it's a threat, or like when a patient or a civilian is threatening you, or when you feel like there's trouble going on around you for your safety to turn on your body cam.
Awesome. Also, keep saying awesome. Awesome. And as well as when you are responding for CPR calls.
Okay.
You always want to make sure you have your body cam on when you're doing CPR calls, just so that way it will protect you as well as the patient. Okay, next question. What happens if a medic uses a firearm while in the medical faction?
You said what happens if they use a fire alarm?
I'm sorry, yeah, firearm, so weapon, while in the medical faction.
Oh, you're terminated. You lose your job. You're not allowed to do that.
Exactly, perfect answer, and that's going to be MD Rule 5. So you will definitely get dismissed if you are using a firearm or having it out on you and, displaying it, and of course if you harm someone with it.
Yes, ma'am.
Okay, question number 11. What is the maximum pill limit per patient?
Patients can only have up to 6 pills.
Perfect. See, even in the background knew that was an excellent answer. All right. Okay, number 12. We have this one and then one more to go, and then we will be finished. When are you allowed to refuse medical treatment?
So when a patient comes in and they're pointing their weapon at you, you do not have to give them any service.
Perfect. Yes. If they're holding their gun out, especially if they're pointing their gun at you, you do not give them medical services until they put that weapon away.
Exactly. Correct.
Okay, so the last one. Can you demonstrate how to teach a green scrub how to do CPR? If you can show me like the full process and drop the correct micros for me, that would be great.
Okay. Lift me up, make me feel like I'm the only one that you love. Nothing lasts forever, so we seize the day. Run away together, going all the way, going all the way. Giving
Beautiful,
up myself,
beautiful.
just trying to keep away.
Thank you so much.
Baby, will you thank you. Let me know if it's showing.
Um,
Anything else?
oh nope, you're all finished with all the questions. You did great. I can hear your enthusiasm and eager to become to rank up and become better and better as you go here with us here at Laguna EMS.
Okay.
So, congratulations, you passed, and that means you will be getting your white scrubs.
Thank you so much, Dr. Savannah.
Of course. So, great job on your first interview with EMS. I do want to go over what you will be responsible for as a white scrub. You will need to complete your first CPR field training with a field training director before riding with Blue Scrubs or higher. Attempt CPR calls on separate days each week. Finish 35 total CPR attempts. Respond only when a blue scrub or above is present after clearance. And submit CPR logs with body cam footage. You'll also complete taser training and safe driving training. In the hospital, you must follow all MD and HP rules. Sell med kits and pills only in the hospital, and keep your logs organized. For pharmacy, you will learn the full structure, completing a 30 vitamin appointment, logging correctly, knowing pill limits and policy, understanding regular and VIP appointments, pill dash, and PD and Army drops. Having your micros ready and passing a 15-question pharmacy quiz. And then once all requirements are done, you'll book your next interview through Setmore, and we'll go from the next and go from there. Do you have any other
All right.
questions for me?
No, ma'am.
Awesome. Well, I want to tell you, you did great. I enjoyed this interview with you. Thank you for your patience. And what I'm going to go ahead and do now is I'm going to send you the welcome packet and checklist for your white scrubs. All right?
All right, Dr. Savannah. I appreciate you.
Of course, of course. And I want to let you know if you have any questions, if you need help with anything, please don't hesitate to ask me. Okay?
Yes, ma'am. Thank you so much for doing my interview.
Of course, of course. So just want to let you know, rank up days for yourself will be on Wednesdays. Today's Wednesday, huh? Oh, great. Today is Wednesday. So you should be seeing yourself in white soon. I'm going to go ahead and let the DCPs and our chief know how great you did. And then, again, if you have any questions for me, please don't hesitate to ask me. I'm here to help you. If I'm not on here, message me on Discord, and I'll get back to you as soon as I can.
Okay. So I won't have white scrubs until Saturday, right?
No. For you, you get them done today.
Oh, okay.
Yeah, so once I'm done with this process, I want to go ahead and submit your interview, and then you'll most likely pop in white, it will just happen.
Okay.
So if you log off, you have to go do some things, then you come back, you might see yourself in your white scrubs.
All right. Thank you.
Oh, no problem. Thank you. So right now you're all complete. Again, congratulations. So you can just go ahead and head downstairs, do what you were doing, pass out some med kits, some pills, and then I'm going to send you over your information, okay?
Yes, ma'am.
All right. Have a good one.
You too, Dr. Savannah.
Thank you.